Hello, I'm Dr. Mark Newman. I'd like to welcome you back. Remember, we know that when you change your health, you will change your life. Our goal for you is to add years to your life and life to your years. Let's focus on the ladies today and talk about bioidentical hormone replacement therapy. I want to remind you to join us next week when we continue this journey to maximize your health and change your life. Okay, today let's focus on the ladies. Let's talk about bioidentical hormone replacement therapy. The definition of that is use of supplemental doses of hormones that have a chemical structure identical to the hormones that your body naturally produces. Now, with the normal course of aging, there is a slowdown of metabolic and physiologic processes, and that, especially for our ladies, concerns their hormone production. Well, we have a term for that, menopause. Now, that can encompass almost decades for some of you ladies, from in your 30s on through your 50s, even your 60s, the signs and symptoms associated with this. Now, we want to remember, hormones are the octane that run the body. For you ladies, especially the estrogen and progesterone hormones are the main players there for you. Now, what are the common complaints we hear from you ladies? Well, loss of energy, weight gain, hot flashes, night sweats, moodiness, poor sleep, brain fog, PMS, loss of libido, vaginal dryness, increased aches and pains, musculoskeletal discomfort, dry skin, loss of hair, infertility, urinary problems. The list could go on, but it can be quite a lengthy list, and it's absolutely life-changing. It sucks the life out of you, a lot of these symptoms can, especially if you've been dealing with them for years. So here's one of the keys. We have to measure to see what's up. To see is to know, not to see is to guess. So we do a variety of studies, including saliva and blood, to look at our ladies, how their bodies are functioning or not functioning. So we're looking at your hormones, we're looking at your thyroid function, we're looking at your hormone of stress, cortisol, plus a variety of other things. Now, here's the key with all of this. You always treat the patient, not the number. We need measurements, we need studies to follow, but we're going to treat you as an individual patient. And the beauty of that is, what we find, if we see that there's areas that need replaced, especially the hormones, your estrogen, progesterone, those will be made by a compounding pharmacist specifically for you, and those will be made from a yam base. Now, that can be different types of things. That might be capsules, it might be a topical cream, it might be a vaginal cream, it might even be a troche that you let dissolve in your mouth. And then also many times we might wind up using supplements to help restore normal function to your body. We're always going to come back to the major points of health, talking about diet, exercise, and stress reduction in conjunction with your bioidentical hormone replacement therapy. And we always stress to our hormone patients, male and female alike, that doing resistance exercise will multiply the effects of your hormone therapy. Now, a lot of ladies want to know, well, how long will this take to get my health turned around? We generally tell you that we expect to see, within 60 to 90 days, you do the things that we suggest, we expect you to have some definite movement in the right direction regarding your health. Ladies, there you go. There's some information on bioidentical hormone replacement therapy. Take a look at our website. We actually have more information, some questions and answers, and how we do this at our clinic. Thanks very much for joining us today. I want to remind you to subscribe to our YouTube channel. Leave us a comment with questions or concerns that you have about your health. Like us on Facebook to keep updated with us, and for more information about the services that we provide, go to our website, drmarknewman.com.